Welcome to Healthline, your favorite medical talk show with me, your host, Dr. Chinema, Lupinda. We are back again with another very interesting topic. This time around, we want to talk about contraception. That is for both men and women. In an era where the socio-economic status of the country as well as the family is dependent on the number of people, it is very cardinal that the number of the family members is put in check by using contraception of various options. That's why today we have invited a very special guest. She's a drug expert, a pharmacist from the Lupinda University Teaching Hospital, Miss Kalwila Ching'embu. Please welcome to Healthline.
Thank you for having me.
Okay, great. So how's it going at Lupinda in the pharmacy department?
Work is good.
Okay.
Yes. We are in the new building now, so
okay.
we are settling in and we're doing okay.
Okay, that's very good. You being a pharmacist out there, it's one of the most challenging jobs in the hospital, really. And we really do appreciate you from the little time that you have given us to come and feature and give us more insight on the topic at hand here on Healthline.
It's a pleasure being here. Thank you.
That is great. Without wasting any of the time, so the topic at hand is contraception. So people out there know there is contraception at the hospital, but then they don't know which options they are. That is for both men and women. So what are the options when it comes to contraceptions for both men and women?
Okay, so for contraception, for men, there's really two options. Very few options are available for men. So the first one will be the male condom.
Okay.
The other one is more permanent. It's called vasectomy. It's a procedure where they cut or tie the tubes, the last difference.
Okay, that part of the tube, the conduit which transports the sperm and all that. Okay.
Yes. So there's only two very viable options for men, the condom and the sterilization method. Then for women, there's a very broad spectrum of options, from tablets to more permanent methods such as the implants and the intrauterine devices. So there's from tablets, pills which are oral daily contraception, then there's injectables which are more longer acting, then the longest acting are those which are implants and IUDs.
That is quite a broad category of contraceptions altogether when you come to think about it. And then actually men, there is contraception as well. She's mentioned the vasectomy, of which I should attest that not a lot of men want to do it because of the nature of how it is and the percentage of them trying to conceive again at one point. I should testify that on that note that we've had a lot of men come out there to say they want a vasectomy, but they end up shining away from it on the day of the procedure. So typical of men to shine away from such a procedure.
The fear with vasectomy for most men is that they're scared it will cause impotence.
Impotence altogether.
And failure to actually perform. So those are the myths that need to be broken.
Of which actually that doesn't happen.
It doesn't happen.
It doesn't happen because you're just cutting the supply of the sperm. And it doesn't really affect
the hormones.
The hormones which are being produced. Great. So one more myth out there, we want you to clear it out very well when it comes to females, because you know, like you mentioned, the more broad category of contraception is leaned more to the women rather than the men. So there are women out there who think contraception makes them gain weight. And then it's a problem if you were, let's say if you were married now and then you were lean, you got married when you were lean, your husband wanted you when you were lean and all that, and then all of a sudden when you are on contraception you start bulging. Does it cause weight gain really?
No, contraception methods, no contraceptive methods cause weight gain.
Okay.
It's not a side effect of any tablet or injectable or implant. There's no weight gain that is caused. Women are likely to gain weight regardless of being on contraceptives or not. So studies have been done to see whether the pills cause weight gain, and they've been disproven. So that's a myth that needs to be broken. If you are gaining weight as a woman, there's options for you to maintain your weight and still be on contraceptives.
Okay, great. So that myth has been cleared out. The contraception doesn't cause you to gain weight per se as perceived by society. So then, when it comes to percentage of the population or people using contraception, how would you tabulate it altogether?
So there's been an increase of women using contraceptives, actually. A very positive increase from about 9% in the 90s, in the late 90s, to 54% in 2020.
Great.
So 54% of the Zambian women, female population, are on contraceptives. So hopefully we can get the other population onto contraceptives, because it's the best method of child spacing and managing the home with our economic status in Zambia.
Great. That's a very big percentage to say, but it's quite impressive of women to get to use contraception. And I guess we should encourage our men folks to also capitalize on the other options, which they don't want to get to really. So getting back to the side effects, we ruled out the contraception causing weight gain. So now, since almost every drug out there could be the normal paracetamol, it could be aspirin, everything comes up with a side effect. So when choosing treatment options amongst these contraceptions, what are the side effects, some of the side effects on a wide scale, which they cause?
Okay, so generally all of them will cause changes in menstrual bleeding. So either there'll be prolonged bleeding or missing of the menstruation period altogether. So that's on a general aspect.
Just generally across the
with the
board.
Tablets, there's mostly headaches, dizziness, abdominal pain. Most women have complained of abdominal pain at the onset, at the beginning of the course. Then afterwards, they are very tolerable. Then with the injectables, the ones that are injected into the muscle, most women have complained, of course, with the menstrual changes, pain at the injection site, mood changes, and elevated blood pressure, which is hypertension. So with the others, like the implants and the IUDs, there's been obviously the dizziness and the headaches, the general complaints appear as well, but also with prolonged bleeding, those are the big side effects. So the advice to women would be that if you are experiencing any side effect which you can't tolerate, just go back to your doctor, your OBGYN, and just talk to them about the option that is good for you.
That is great. Well elaborated there by our pharmacist in the house, who's talking about contraception options and which one is good for you. Don't forget to download the MedSage app out there, where you can find different pharmacies where you can access medicines, and as well as clinics and hospitals where you can have all these services provided for you. We are going to continue with the topic at hand after we come back from a break. Please stay tuned.
Do you own a pharmacy, a clinic, a laboratory, or even a hospital in Zambia, and you'd love to increase your visibility out there? Well, there's a simple application for you. It's called MedSage Zambia. MedSage Zambia is a medical directory app that allows or gives your business the widest visibility out there for those new and more customers. So you can simply subscribe to MedSage Zambia, or you can simply call the number on the screen, and let's do business the easy way.
Welcome back to Healthline, and today we've got a pharmacist from Levi Mwanawasa in the house who is describing to us the various options of treatment when it comes to contraception. Altogether, she was talking about the side effects of which delayed as well as menstrual problems came in first. She's yet to elaborate some more on the other options when it comes to side effects of these medications when you are on them. So you mentioned to say there's hypertension, which comes sometimes when somebody is put on contraception. So it is therefore cardinal that an assessment is done on the patient before they commence this type of contraception. So which type of contraception is this really?
Yes, so I must mention before anything that not all women will experience side effects.
Okay, great.
Contraceptives are very tolerated amongst a lot of women. So the very few women who will experience these side effects, it's not the end of the road for them. They can always be switched to a different type of contraceptive. So the one that causes or may cause hypertension in some women is the injectable. So there've been a lot of complaints to say I'm having heart palpitations and elevated blood pressure, my pulse. Yes, so an assessment should be done on the woman before commencing her on any injectable contraceptive. If there's any familial history of any heart disease or any cardiac problems or deep vein thrombosis in the family. So for those women who've got history of hypertension in their family, other options should be given to them rather than the injectable. So there's always other options.
Okay, great. So you're hearing it here first time when our pharmacist here is explaining to us the cardinal or the important part where you have to make sure you know yourself. If you are hypertensive, if you come from a family where there's diabetes, there is hypertension, it's best that you are checked first by your physician or your gynecologist before you commence on these type of contraceptions. And there are different options altogether. If you are hypertensive, they can adjust according to your condition, where you are put on something which suits you in that condition altogether. So yeah, continuing on the side effects again, because that is one of the things people are scared of really, because they don't want to get on this and then afterwards they have an outcome which they can't tolerate really. So there's a special type of contraception which you mentioned in this category, the IUD, or called the loop out there. So then does it cause or worsen the periods of an individual altogether?
Yes, in some women there's been reports and complaints of a prolonged bleed.
Okay, and I like that part when you emphasize to say it's some women, not everybody.
Yes, not all women.
Okay.
Yes, so women who experience prolonged bleeding, the menstrual bleed, will be maybe even twice the number of days it normally is. So this is in the beginning when the loop, the IUD, is still getting accustomed to the body. So after a period of 5 to 6 months, the period will return to its normal flow. So if women can just tolerate it for that 5 months, 5 to 6 months, then the flow will be okay. And the loop, I must add, is the most tolerated type form of contraceptive. Yes. There's minimal side effects, close to none with the loop, because it's not hormonal. It's a copper it's a copper insertion. Yes, so there's minimal side effects apart from the prolonged bleeding.
Okay, great. So now, because this partner or an individual altogether who has chosen an option in contraception would want to know now, after commencement of this type of contraception, when can I start having unprotected sex? When is it okay? Because they don't want to delay anymore because they're already on it. So do they need some time for the medicine to act so that it can cause the desired effect on them?
Okay. Yeah, this is a common question that I usually get from women. When is the safest after they start oral contraception? With the injectable, the injection is available in the system almost immediately, so it's safest to start being active, must I say. But with the tablet, the pills, there's a very minimal amount of contraceptive, the drug, either the progesterone or the estrogen. So most of them are at 0.05, 0.03 milligrams of the drug. So it has to build up in the system. So most women, just for their own safety and for effectiveness of the drugs, they're advised to start the contraception at the beginning of their menstruation. So on the first day of the menstrual period, you start your contraceptive pill. You take your first pill. By the time it's down the week, when your period is finishing and going forward, you would have built up enough amount of the contraceptive in the system to give an adequate amount of contraception.
Great. I like that point where she's emphasized to say when you start contraception, especially the pill, it has to reach a peak concentration for it to be effective and produce the desired outcome. So don't be in a rush. Make sure you take it at the right time. Best advice being
at the beginning of the menstrual
cycle bleeding, you start in the desired outcome will be achieved. So then more questions coming in out there, because this one comes out earlier than any other question really among us, especially for women who are not married yet, or they are single women but they are sexually active. Some people who are married, I don't know, you just have partners. Is it that when you get on any of these contraceptive options that you have given us, is it possible that you lose your fertility? Because most women out there are scared of losing their fertility when they commence this type of contraception.
Yes, and we as health workers, you and I, we are aware of these myths that are out there. Of course, no contraceptive method causes infertility except for the permanent one, which is available for both men and women. Vasectomy for the men and a bilateral tubal ligation for the women. But the other hormonal contraceptive methods are not capable of causing infertility. Although, might I add, they work at a varying range. You know what I mean? I mean to say, some are short acting, there are those which are intermediate acting, and the ones that are long acting. So for those who are single women, the most advised ones are the short acting, so that at a point when they want to conceive, they can easily stop and conceive. For the longer acting methods, which is the loop as well as the implant. So the infertility myths come from the implant, especially because after taking out the implant, a lot of women have complained of not being able to conceive for a prolonged period of time. This is because the drug that was being secreted by the implant still remains circulating in the system of this woman. So it's going to take a bit of time for that drug to completely run out and be excreted from the body. So it still continues giving the effects of contraception even after removal of the IUD or the implant. So some women have complained of going for over a year without conceiving, but that doesn't mean they are now infertile. No, just see your gynecologist and see about going forward without any contraception and trying to conceive. So there's methods to enhance conception, for women if they're really struggling. Yes.
Okay.
But with the oral formulations, the injectable formulations, there's absolutely no fear of infertility or prolonged waits to conception.
Okay. Yeah, great. So just to bring you back on that point which you emphasized. So when it comes to single women, not married, but then they're sexually active, would you encourage them to go on contraception?
Exactly, obviously, of course. Definitely. So just know your options. See your gynecologist, weigh your options, see how long you want to wait until you can conceive.
Okay.
If it's a matter of a year or months, there's always options. There's an injectable which lasts for 12 weeks. That one is okay. Even the tablets, the minute you miss one tablet, you're at risk of falling pregnant. So the tablets are the best.
So they have to be consistent.
Yes.
Okay.
Most women are advised to set an alarm on their phone because the pill has to be taken every day at the same time.
At the same time. Okay. I like that emphasis where you are advising them to really be taking them at the right time and every day at the same time.
Yes.
So you're hearing it here. She's explaining to us exactly what we need to know and busting away all the myths out there in public which are not there. So it is really a very interesting topic. I'm sure you're really learning quite a lot. Single women out there, those who are married, the information is out here for you, and then make sure you practice these things that our able pharmacist here is explaining. We are going to take another short break, and when we come back, we're going to discuss more on this topic. So don't go away and stay tuned.
Hi, do you own a pharmacy, a clinic, a laboratory, or even a hospital in Zambia, and you'd love to increase your visibility out there? Well, there's a simple application for you. It's called MedSage Zambia. MedSage Zambia is a medical directory app that allows or gives your business the widest visibility out there for those new and more customers. So you can simply subscribe to MedSage Zambia, or you can simply call the number on the screen, and let's do business the easy way.
Welcome back to Healthline. I'm here with our pharmacist, Miss Kalwila Ching'embu from Lagos University Teaching Hospital, who we are discussing with contraception, that is for both men and women. She was elaborating very well on the options when it comes to single women, as well as those who are in relationships, as well as those who are married. So to continue again on this very interesting topic, Madam Pharmacist, when it comes to expecting of the periods or the menstrual periods, when a woman is on a contraception, do they expect it or it's supposed to go away?
No. So with the apart from the tablets, the other forms of contraception, the period should be normal. But with tablets, there's two options. There's the continuous pill and the break pill. So when I say the continuous pill, I mean the ones which come with continuous doses of the hormonal contraception, contraceptive drug. Then there's the break pill, which has a placebo pill. So there's 4 weeks of the cycle, and the last week is a placebo pill to allow for the body to bounce back and be able to have the menstrual bleed. So it depends on how you want it as a woman. You have options to say, okay, I don't want to be having my periods all the time, so you can go for the continuous pill. And if you want to be seeing your period every month, you can go for the break pill, which has the placebo pill, which doesn't have the contraception.
Okay, awesome. Really, that is very helpful altogether. But then, busting the myths again, do contraceptions cause cancer?
No.
Okay.
Okay. So
That is a straight no.
That's a straight no. There's no evidence.
No evidence at all.
There's no evidence. In fact, contraceptive pills have proven to reduce risk of cancer, ovarian cancer as well as endometrial cancer.
Okay.
Yes. So with breast cancer, most women are told, if they have familial history of breast cancer, they are told not to take oral contraceptives, the pills, because there's not enough evidence to show whether it causes breast cancer or not. So that's where the evidence is not clear. But with other types of cancer, it actually reduces the risk by 50%.
Awesome. So it's actually a myth which has been.
Yes. So it's actually good to be on
contraception altogether than when you are not. Okay. A quick thought came through when it comes to emergency contraception. You know, it's sold out there. You don't need a prescription for it, and then there are some women who literally take it every time, the emergency pill, where if you have an unprotected sex with your partner the previous night, and then in the morning you rush to the pharmacy to get it. How often should one take it? Because women out there, they are taking it every day.
So the emergency pill has a very high dose of the drug that is used in the daily pill. So it gives the body a very high concentration of this drug, and it's not good to be taken every day or every so often. So the most advice I'd give is to take it once a month. Once a month is okay. Yes, especially when you are during your ovulatory days, you can take the pill. But in the event that someone is using it, a woman is using it too many times, the effectiveness reduces. They may actually fall pregnant. So a lot of women have complained to actually not have had the pill work. It's only because they took it too many times.
Actually, I've seen some people come to say, actually, I took the morning after pill and then I fell pregnant. So taking it too many times reduces its effect when it comes to you not falling pregnant. So you should take caution on that. So then, on the last note, when it comes to the emotion aspect of the side effects, do contraception cause mood swings and all these kind of emotional disturbances when you're on them?
Not to everybody, but yes, there's been a few complaints and research has shown that there's some mood swings that have come about with the oral contraception, the pill. Sometimes even the injectable. So these may cause a bit of a mood shift in women. They may not know. Some will experience somnolence, just absolute sadness for no reason. Yes, so they just have to manage it and know that, okay, this is being caused by the drug. If it's, like I said earlier, if it's something that you can't tolerate and is affecting your quality of life, go back to your gynecologist and weigh your options and find a better option for you.
Okay, great. It has really been a very interesting and well highlighted topic by our pharmacist here in the house. We really appreciate you discussing with us and the viewers out there about this cardinal topic altogether. So any last words out there to the viewers who are watching us, who have been keenly watching and following this session of Healthline?
Okay, so to the viewers, to the men and women who'd like to manage their sexual life by use of contraception, I'd encourage everyone to weigh their options, find out a lot about contraceptives. They're good for us, they're very safe to use, and there's always an option for each and every one of us to be safe. And if you want optimal safety, just always go for the condom. It protects you from having unwanted pregnancy as well as sexually transmitted diseases. But otherwise, if you have a faithful partner, one partner, just go for the contraception methods that are available. and stay safe.
Awesome. So really, it couldn't be more emphasized more than she has emphasized on this cardinal topic altogether. And men out there, you're also being encouraged to participate in contraception amongst these options, which are quite few, but they're there. For example, the vasectomy altogether, when you participate in contraception, you make it all easier for our women out there. So you should stay tuned for very more interesting topics to come here on Healthline. It has been a pleasure to have you, Madam Pharmacist Kalwila Ching'embu. We're looking forward to inviting you again to have more discussions on this topic. It has been me, your host, Dr. Chinema Lupinda on Healthline. Catch me again next week, Thursday at 20 hours, right here on Live TV.